Well, we're shifting now to Wellness Central. And this morning, we're talking about something many of us don't think about until it's suddenly too late. From road accidents to medical emergencies at home, in church, at work, or even on the street, first aid can be the difference between life and death. Yet I am sure many Nigerians would admit they don't know what to do when an emergency happens. For example, in the case of Anthony Joshua's road accident.
Talk about Anthony Joshua's road accident. That was a poster for the world to see how bad it is in Nigeria. But to help us understand the basic first aid steps every single citizen should be familiar with, we've got Dr. Miriam Alhassan. She's a radiologist. She's here not just as a medical professional, but also as someone helping us, well, to become safer, more prepared. Well, Doctor, good to have you here on the show. Thank you very much. We had a very interesting conversation before we came on air.
Yes.
Conversations we can't tell you about. But welcome and grand to have you here.
Nice to have you here.
Did you see the video, Anthony Joshua being extricated from inside of a damaged vehicle where he could have lost his life? In fact, he lost the lives of 2 of his friends. And first time I saw that video, I was like, oh no, that's a very bad way to actually extract a person from a vehicle. And I was wondering, where are all the responders? I know the answer, absent. But what did you think when you saw that video?
So I didn't finish watching the video. It was a bit heartbreaking. But I think for one, because when an accident happens, everybody is in a huff about it. So usually the first thing which most people don't understand or know is when there's an emergency, calmness is key. Calm. You have to be calm, because then you can be able to organize, then you can be able to control the situation and direct, and then get where you need the person to be at a safe pace. So the thing with emergencies happening in Nigeria, it's not necessarily that we are absent. You say that the responders are absent. It might not be that we are not present. It might be that we were not even called. Because usually the first thing you come, you want to assess the surroundings, make sure that whatever is happening has stopped, or remove the person from that area that the problem is happening as. And this is not just for the person, it's also for you. You don't want to end up being an emergency as well. So for yourself and the safety of the casualty, you need to move the person from the initial site, especially if you know the harm is still ongoing. So when you're bringing out this patient from that casualty, from the area, there's a lot of things that needs to be done. So you want to make sure that you're not underestimating the level of injury. So for us, most times we just go expecting the worst. Maybe the person has a C-spine fracture, maybe there's some other injury somewhere else, maybe there's internal bleeding. You don't want to move the patient all too much. So
basically, don't move the patient.
No, move the patient, but in an organized manner. So you don't want the person's head maybe hanging down or being curved. You want to be able to stabilize. So you need more than one person in that kind of case. Calmness comes in. Okay, when you're calm and you look like you're in charge, most people tend to gravitate towards that. So it's okay, I need 4 people, 1 person to handle the head, another person to be at the back of the chest.
Just for support all through,
so that you can be able to align the person properly and keep everything straightened and bring the person out safely, and then move the person away from that site, because at that point, everybody was just everywhere. You don't know if that car is going to explode. You don't know if there's leaking fuel. Nobody's really assessing the situation. So calmness, assessments, and then going to help. The main thing, you need to also ask for help. Because sometimes when it goes down to where you need to do CPR, it can take hours. You don't even know what your strength is. You might have not eaten that morning and you come across an accident. CPR alone is dangerous because you can end up needing help. So you need to call for help. In some cases, if you have a phone, call first, call fast. For children, call fast. For adults, call first. So you call for...
Call first, call fast. For children,
call fast.
Call fast. For adults,
call first.
Call first.
So you've assessed the situation, you got the person out, ask for help, call for help. Scream, shout, get people around you. So at least somebody else who might know how to do CPR can join you. So 2 people doing it is more effective than you doing it alone. That does not mean you shouldn't do it alone, because I've had a situation where my cousin was at church and somebody had a cardiac arrest and she was a nurse and she was the only person. So she had to go ahead and do it, and she saved the person, luckily enough. So the thing is, most times you're going to need help. Unfortunately for her, she didn't have help, and she was a new mom. So luckily enough, somebody called fast and got help there. So she was able to be relieved of the CPR and person taken to the hospital. So usually the first steps, you need to be calm. You need to assess the situation. You have to make sure that you're taking care of that patient and yourself. Because you don't want to put yourself in a situation where you are now alone, nobody's around, and then you now become a casualty of the situation. So first 8 steps, assess. You also want to check this patient. Patients are weak. Can person speak? Can person give you a history of what happened in case you were not even there? What happened? What the person might be allergic to? What the person's cases could be? And then if the person is not, maybe the person is drowsy, you want to be able to make sure that this person does not injure themselves. So you're moving the person away from any other thing that is injurious around the patient. Then if the person is in a stupor-like state, that means you can wake the person up, but the person goes back into coma. You also have to make sure that everywhere around the patient is safe. There are no sharp objects, there are no nails, rusted items, or any other thing there. You want to also check if the patient is bleeding. Because sometimes you're in a situation where there's adrenaline rushing. It's not just rushing for you. The patient is also having adrenaline, and it sometimes acts as a pain barrier. So the person is not really feeling all of the pain. So they can't really tell you exactly where else is hurt. So you have to check. Is there any bleeding? Do I have to open up any part? Because having clothes on it that might have been stained, dirty, can cause infections. So you want to open it up. If there's active bleeding, you want to be able to compress, make sure that you stop the bleeding, maybe even elevate the limb if needed, just so that circulation is still continuing.
I don't know about you, Queen, but that sounds like a lot.
I wanted to ask because, you know, I think the first thing you said was calmness. I remember when, you know, they're picking me up from school and then I was sleeping. I woke up into the accident.
Oh, wow.
And the first thing they did was they took me out of the car and they told me to sit on the floor. Whereas me, I was trying to find my friends and all that. They're like, you that you're saying you have power, you're the one that is not. And truth be told, when I go home, I was the one with the highest fever. So, in as much as a lot of Nigerians are now like journalists, when something happens, the first thing they do is take out their phone. And a lot of people, I think to them, first aid is Band-Aid and their ventilator spirit at home. How do they learn the basic things? I don't think I know how to give CPR. So how can Nigerians learn, and how long will it take for them to just learn these basic things so that if they find themselves in a situation to help, they're able to help?
Okay, so for first aid, usually you can even get it online. First aid is the first thing you should learn because CPR gets a bit advanced. And in case you don't even need CPR, you need the first aid. So like for my association as of last year, during our week, we're able to do like a first aid demonstration for the bikemen in that area because we've seen a lot of bikes. Guys? Yes, a lot of them have accidents that can be...
Because they're always driving like they have 7 lives.
Exactly.
Don't they? I thought we all do.
I know when I learned first aid, I was not even in medicine. I was still primary school, and it was shown on TV. NTA, Silverbird, most of them do that. So it's a thing of either you go online, Google can help you, Facebook is there. Just search in first aid, it will give you a list. Some mothers are so good at putting that little box that has all the drugs in it. That's your first aid, but
Danish cookies.
That is your first aid. So you already know that when there's an injury, you clean. It's done at home. You clean before you put any other thing on it. You might have to use disinfectant at some cases. But when you're in a place where there is no disinfectant, pure water is your best friend. Just use it and wash it off. Get a clean cloth. If it's a marketplace, it's even better. You can get somebody to get clothes from somebody and then wrap up, tie up. If you know that, okay, you're not sure if this person has a fracture, you want to make sure this person's head is neutral to the body. It's not hanging down, it's not hanging up. Even if the person is lying down, you want to make sure it's not on an elevated plane. Except the person is sitting and can't talk. Then you can say, okay, sit down. You want to check, expose. That's another thing. Coming into emergency rooms, ABC, airway, you want to check the airway. You want to make sure the person is breathing. And then you want to check the person's body. So you have to expose. You have to expose. You have to make sure that you are seen everywhere to make sure that, okay, there's no other parts that are injured. So for first aid, usually I would say it would be advisable if a lot more communities and agencies can go out and teach the public. Because most times, demonstration is best. I can say all these things now and the person wouldn't know. If I see a cut that is on a different plane, how do I handle it? Most of them don't know. When I was involved in an accident, all I had was this woman that just tied me because she noticed I had a gaping wound somewhere. And everybody was shouting, sit down, sit down. I'm like, but you just said I'm bleeding, and I didn't feel it. And
that's the thing, because when these things happen, especially in accident situations, you hear the confusion, the people who are even taking the air that you're supposed to be breathing. And you're like, what? Most Nigerians need to know that that's not a time to gather around a subject. But we don't know that because, like you say, most people need to be re-educated when it comes to first aid. But there's this other thing. You said somebody just came tied and blah, blah, blah. However, I noticed that there's a culture, and let's dispel these myths. There's a culture in Nigeria when a person collapses, we pour water on them.
Yeah.
Bucket.
You want to shock the person. It sometimes helps because...
So is that okay?
It sometimes helps.
Okay.
Because even with kids, when they are born and they are not breathing, you want to shock them into...
So shock therapy, that's okay.
So the water might be fine, yes. But it depends on what's going on.
Okay.
Because, it's collapsing, yes. Try the water if the patient wakes up. If not, you have to go to the next thing.
Which would
you want to apply pain. To see the person,
pain?
Yes, if the person will.
I'm naturally averse to pain. I don't know why you're that.
Or you rub the chest
a bit pinching, down. Not pain.
To see if the person will be able to react.
Okay, at least
so when the person is unresponsive, then you now go to CPR.
Secondary school, JSS1. Hafiz came through class and was yelling, Shibi, 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 Shibi. Spoon. I limited Yoruba. And when I looked outside the class, I saw this girl collapse. She was having a seizure.
Yes.
And they did get a spoon and they tried to force it inside of her mouth. I'm wondering, in cases of seizure, what do people do? Because it's a Nigerian thing. You put a spoon in your mouth to stop it from swallowing your tongue.
Don't put anything in the patient's mouth at all. Because the thing is, the muscles are locked in. Sometimes they are jerking. Now, if you put anything inside, you're already having a situation where you have to check the airway. You have to make sure that airway is open. Because your tongue, just your personal tongue, can roll back and choke you. Now imagine putting something inside there. And sometimes the force in this thing can break whatever you're putting there. Even that spoon that I think, because the metal could be very, very thin.
Yeah, that would affect the teeth, the jaws. You're talking about.
It could break it and then swallow. Now you have another issue.
Oh dear.
So now you've blocked the person's airway. The person can hardly breathe.
What exactly is happening when a person is having a seizure?
So it has to do with your brain. Let me just go down to the layman's language. It's like the wiring in your brain. You have what we call chemicals that fire, that allow you do what you need to do. Now, if a certain chemical is being produced a bit more and what clears it off isn't there, you now get a seizure. So it's like things are crossed. Something isn't working and something's overworking. So the body just...
Like an electric shock.
Yes. So your body just goes down to that. So sometimes it could be different types. And funny enough, there's one called absence. You don't even know the person's going through a seizure. The person is sitting down just staring. And you think it's a blank stare. You wave, you scream, you shout. After the person goes, okay, what's going on? The person may have had a seizure.
And in that time, they have no recollection of whatever happened?
They have no idea what happened. So
just from 9:13, they wake up at 9:45?
More of they are awake when it's happening.
They're awake, but they're not aware.
They're not
aware. So they come aware like after they could be, it could take how long?
5 minutes, less. But the thing is, you want to stop it from going past to that 5 minutes because it could injure the brain.
Wow.
Yeah.
Dr. Alhassan, in a roundabout way, and to summarize this in less than a minute, what must everybody know about first aid and what to do when the time comes to apply it?
Okay, so for first aid, calmness is key. Because if you're not calm, you can't coordinate what's going on. And you can't think well, you can't make decisions on time. Once you can realize that there's something going wrong with the person, call for help immediately. Call your neighbors.
Call for help.
If you have, I'm sure we have a lot of emergency numbers in Nigeria. You have hospitals that have ambulances. Call. Another good thing is if you can have that directory, it's best if you can build a directory. Then call for help.
And these are based on if you don't have the expertise, but if you do have the expertise, or if you need
If you have
these
the
expertise.
expertise and you checked, you found out the person is normal. Like now, if someone has a stroke, sometimes people don't even know. They call it spiritual attack and all of that. But if you cannot raise your hand or one side of the body, or you see the person speaking and there's slurring of the words, or the mouth is moved to some, immediately call for help. At that point, call for help, get the person to a hospital fast. There's a 3-hour gap in which whatever the obstruction is or the bleeding is can be managed, and person can get at least, if not 90% or 100% of their abilities back. Delay in any situation can always be worse.
Wow.
So the faster you get to the hospital, it's like for children, if a child is choking, the whole neighborhood will hear. So it's not different for adults.
Okay.
Wow. Thank you so much, Dr. Miriam. It's such an enlightening, you know, when you hear about these things, you're like, oh, yes, that's it. But having to just, you know, uncover all these things, it's beautiful.
Wow.
Well, thank you so much for
Thank you
joining
very
us
much.